Hi, this is Gina Lento. This is my presentation on the Joint Commission and CMS. First question is, what is the relationship between the Joint Commission and CMS? Well, CMS is a government agency established in 1965 that provides basic health programs for Americans who don't have health insurance. So it is part of the Department of Health and Human Services. CMS administers, essentially pays for medical care and oversees the Medicare program, which is for older Americans, the Medicaid program, the federal portion of Medicaid for the needy, and CHIP, which is the state children's insurance program, and related quality assurance activities, including the certification of hospitals according to established standards. In order to receive reimbursement from CMS, hospitals must meet eligibility standards, which are established by the CMS. The goal of the CMS is to improve health care for the public, and accordingly it sets standards for assuring that healthcare organizations are providing safe and effective care at the highest quality and value. And so this is their stated vision. In other words, they need to ensure that healthcare organizations do zero harm. The Joint Commission is one of several organizations approved by CMS to certify that a healthcare facility meets these standards. So the Joint Commission is one of several organizations approved by CMS to certify that a healthcare facility meets their standards. This is a table taken from this reference. It shows some of the other accrediting bodies and the areas that they do accreditation for and the type of standards that they are testing for. So our second question is, what does it mean to have Joint Commission Medicare deemed status? So if a hospital is certified by the Joint Commission, they are deemed eligible to receive Medicare and Medicaid reimbursement because they have met or exceeded the requirements set by the CMS in their conditions of participation. And the Joint Commission website describes the accreditation process, which is submitting an application, paying a fee, and then there is an on-site survey by some surveyors who are skilled practitioners. They prepare a survey report, and then an accreditation decision is made, and there is one of 4 decisions that can be made after a review. And finally, I know there is a specific way that CMS will be notified of your accreditation and survey outcome, because in the the resource that we were pointed to, the 2016 Crossroads paper on the Joint Commission and CMS, in part 1 there is, in the table of contents, this question: how will CMS be notified of the Joint Commission survey results? I cannot access that document, and I have searched and searched and searched all over CMS and the Joint Commission's websites and various other websites, and I cannot find specific explicit declaration of how they will find out. But from what I've read, I think it's safe to assume that the Joint Commission prepares its report and notifies CMS of its report, and successful accreditations will actually, all the decisions are published on the Joint Commission's website. So I wish I knew the real answer, but I can't access the material. Thank you.